Hair loss baldness grade 3, the best stage to act, neither too early nor too late. The sweet spot. Stay with me because what happened in 5 months goes from here to here. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon working at Saraswat Hospital Agra, dealing with hair loss patients for hair loss medications, therapies and hair transplants for past more than a decade. We are here to educate you regarding various hair loss problems, their causes, their managements, what to do, what not to do. So do subscribe this channel for many more such science-backed solutions. So this guy was just 25 years. He had lost his hairline. The frontal area was very minimal and it was extending backwards. So when he came for consultation, we not only advised him a medical treatment for the remaining hair, but also we wanted him to strengthen his frontal hairline so that there could be a good frame of face, which is very important for a guy who is in mid-20s who wants to step out confidently but is not able to do so because he's feeling bad inside due to his lost hair. So before undergoing the actual hair transplant, he wanted to see how he would look after the hair transplant. We asked him to take help of Saraswat Hospital App PeekAI feature. You just have to download the app, click on the PeekAI, upload your front and top image. Within 24 to 48 hours, you'll be getting your probable images along with probable number of grafts which would be required by you and some questions which will help you understand your hair transplant better. So when his trichoscopy was done, we found out that his donor area was sufficient enough that we could take the required number of grafts. On calculating the recipient area, we found that the number of grafts required was somewhere around 2,800 grafts. So we chose the follicular unit excision method, FUE method, so that we could cherry pick the best of the grafts. And then we artistically rearranged, keeping the very softer ones towards the frontal hairline and then gradually increasing the thickness of the grafts along with the density maximum in the central area. This is how we plan to put the required number of grafts on your scalp. Why? Because the number of grafts which you have actually lost is much more than what we have in hand. So we have to put it in a very judicial way. In the comment section below, you can comment your hair loss grade or you can ask your questions. On the screen now, you can see a detailed trichoscopy report of our patient. How many 1 hair, 2 hair, 3 hair, 4 hair grafts were there so that you understand how the grafts are sorted. If you want a personalized treatment plan, you can call us on the numbers below or you can send us your pictures. Now you can see the sequential pictures of our patient on the day of surgery, a few days after surgery, 3.5 months after surgery, 5 months after surgery, and listen to what he has to say for his results just 5 months after surgery, along with his combing video.
I have my hair transplant in October start and now it's been 5 months since my hair transplant. I had a balding in my front hairline, and now it's 5 months and I have a lot of good growth in the frontal area. I'm really liking how it's going to turn out. It's very visible density change and very visible change in the look. It's just 5 months and I hope that in the next coming months it's going to be great. It was said that it will take 12 months to get my full look back and it's just 5 months, so in the next coming months it's going to be great. So yeah, I am loving it.
We are happy that we could deliver what the patient actually wanted. Do not forget to share this video with somebody who is losing hair and who needs hope. If you want to know the cost of 3,000 grafts hair transplant, you need to click the video on the left.